we're very excited to bring this out to everyone, share this. And I know, Dr. Cooney, when I heard you speak at our meeting, it really, really touched my heart in so many ways. And I've been an RVT for, I guess if I didn't stretch the truth, it'd be 40 years. It's real kind of hard to say, but and you do get hardened to some degree, and I don't never want to lose that compassion, and it happens, and you bring such light to it, and gosh, I was so touched that I really wanted to share this out there with everybody. So
thank you.
Thank you for being here. I think we're getting there. Do you want to go ahead and we can get started? You do have an introduction on there. This is going to be Dr. Cooney is going to be talking to us about compassionate euthanasias and the healing our hearts, and how to deal with those kind of situations out there. She's been working with the AVMA and AHA accreditations, and this her training, it was really kind of follows along those lines, and there's something for everyone out there. So welcome, Dr. Cooney. Thank you.
Thank you, Lori. You know, when Jorgensen asked myself and the Cato program to give this talk, we immediately thought, how can we make it as real as possible, right? And dial back down from all the, you know, loads of information that's out there, first of all, about compassion fatigue and moral stress, euthanasia related stress, everything we're just involved with euthanasia work. And how can we just dial it back down to the realness of what we're really doing out there in the trenches, right? The day-to-day work, especially with COVID and all those complexities. And I thought, let's just make it as light of a half an hour as we can, with some really useful information that you can apply in daily practice, but also hopefully apply in your personal life. You know, those things that you can do after work and on the weekends, and whether or not you're on vacation, and say, you know what, I want to harness all that beauty and things that I do in my personal life and bring that into my work, so that my work is very fulfilling and sustainable, right? I think it's interesting that there's so many practitioners out there just like me who have dedicated their entire career to euthanasia or hospice end of life work, and can do this day in and day out and still want to get up the next morning and do it again. So what is it that we have found, you know, what kind of magic is a part of our professional life that we can then share with those in traditional practice or specialty hospitals, ER settings, just to kind of, again, find that inner peace and balance to be able to help so many pets with euthanasia. Okay, so I'm really delighted to be here. Thanks to Jorgensen for the invitation. And let's go ahead and get started. There is a lot to cover in a half an hour time, but we're going to try to, again, take it very organic, very easy pace if all goes well. I was actually on a presentation last night for 3 hours listening to someone else speak about controlled substances. Fabulous talk. But the woman was talking so fast that at the end of it, we were all like, ah. But there's so much to know, right? There's so much to know. And the same could be said for euthanasia and, again, compassion fatigue and our heart's work, but we're just going to scratch the surface today. Again, I'm going to try to go at a good pace. So, you know, just really thinking about what's the most important thing for us to talk about right now, it's going to be a bit of that COVID reality. This is what we've been facing so much in the last, well, pushing certainly a year, almost a year and a half now, and all of the strain and challenges that comes with that. So we're going to touch on it. Then we're going to talk about this concept of euharmony, right? How can we leverage the beauty of a euthanasia appointment to sustain us through the rest of our day, where we don't have to, you know, dread euthanasia appointments. We can actually capture the beauty of what they provide to fill our heart and our soul. And then if all goes well, we'll have some Q&A time. So everyone, you do have a chat box, and I would invite you to go ahead and put a little welcome message in there. Tell us where you're from, anything that you'd like us to know, but just that chat box is available, and you can start to pop in questions as we go along. We'll take a look at those, and certainly we'll circle back around to them in Q&A time as well. All right, so what is the Companion Animal Euthanasia Training Academy? This is a program that I started back in 2017 with the goal of providing outstanding education in companion animal euthanasia to improve the overall experience for the pet, the caregiver or client, and the veterinary team. So we have a master program that's 10 hours long, a certificate program that is offered online or in person. And we do have an in-person training coming up in Orlando, I'm sorry, not Orlando, Tampa, with the International Association for Animal Hospice and Palliative Care. That's the only one that's going to be available this year due to COVID. But man, we really love those in-person trainings. We have a laboratory with cadavers where we practice techniques, and we really want to make sure that you've got the skills to deliver quality euthanasia. But beyond our master program, we've got a whole CADA community where all of our graduates and our students get together and we talk and brainstorm about quality euthanasia. Our website's got a library of resources. We've got a new department that we're starting up on euthanasia case reviews, where if you've got a challenging case, you can bring it to us and we'll help you to kind of break it down and figure out if it was, if it played out the way that it was supposed to, or whether or not there's any risk of malpractice there. We have a whole new hospital training program, and we've got the team training manual. We help with legislative support around the country, around the world. We're teaching in the universities. We've got international perspective and scope there, so we know what to do if we run out of pentobarbital euthanasia solution. And then certainly helping with some product recommendations, so you know what's the best products to reach for. So this is an academy. We teach all over the world best euthanasia practices, and we love to help you. So if there's anything you're struggling with euthanasia, we can support you. You'll notice on most of the slides that our website's at the bottom, our web address, and you can learn more information there. All right, what's important is that we all take a deep breath and zen for a minute. And let's just look at this beautiful picture, which is actually taken in Scotland. I think they call this the Fairy Lake or the Fairy Falls. And, we found in all parts of our day, nature is very important. This would be considered a biophilic kind of element or biophilic essence in our day, where we ground ourselves in nature and we can be soothed by it, relaxed by it. So I'm going to have a couple of these pictures throughout our presentation, maybe some fun ones too, just in case instead of nature, humor is what relaxes you. But anyway, I just love pictures like this. I hope you do too. And that your hospital hopefully is covered with images like this as well. So let's start with COVID. This is something that I put out on the beginning of last year, is this idea of providing, protecting, and preserving the euthanasia experience for the betterment of animal welfare and the human-animal bond. What can we do to not take away all those fundamentals during COVID, but instead try to retain as much as we can? And I'm the first one to tell you, it's been hard, right? I haven't had to do a lot of curbside euthanasias, which I know some of you have had to do. We have found out how to, keep the family involved, but there is no doubt that separation of space, that social distancing that we've had to do, we might not even been allowed to have the client in the room. They might have had to say goodbye before the pet walked in the door. That has really transformed a lot of professionals, that's for sure. In fact, I've had colleagues say, I don't even want to do euthanasia right now, right? It's not even worth it. If I can't hug my client, if I can't have them in the room and touch them and engage with them, it is not meaningful and it's actually damaging. That's the reality, but we have been doing the best that we can. We know that the end's in sight where we can get back together in that fellowship and that protection. But, I'm just going to be honest, it's been hard. And if you have been feeling increased moral stress and compassion fatigue and burnout and all of those things because of it, you're not alone. All right, you're not alone. There is a great test called the ProQual test, the Professional Quality of Life test, that you can find at the URL proqol.org. I think it is, could be .com, but I think it's .org, where you can take a test on where you fall in the spectrum of compassion fatigue and burnout. Okay, so burnout is a part of compassion fatigue, but just want you to know that a test like that exists. It'd be a good idea to get a gauge of where you fall right now. Okay? But the idea is that no matter what, euthanasia remained an absolute necessity. We didn't stop this procedure, especially because we wanted to make sure to end suffering when it was necessary. This is what I looked like in the early days of COVID. I since took off the apron, didn't stick with it, but other than that, it was nobody knew what was going on. Remember, we were back in those days wiping down our groceries. So this is what I look like, and there's nothing about this that says I'm here to be with you in companionship right now for this euthanasia. This kind of says like, stay away. Even the animals looked at us differently when we looked like this, but we had to do what we had to do to be able to continue to provide vet med. So anyway, just want to let you know that I looked a lot like you, certainly. So with protection as well, we wanted to protect our mental health. So not only protect us from the virus, protect our clients from the virus, but to protect our mental health. And these were some of the ideas that came out that I thought were really helpful, that if you're still doing curbside appointments, or the families aren't able to be there, consider doing a pre-appointment connection where you're just calling the family saying, hey, I know you're not going to be able to be here in person. Just wanted to, let you hear my voice and let you know that your beloved pet's in really good hands with me. Is there anything that you want me to know? Those types of things, right? That still allows that connection, just not in the way that we're used to. The other thing here is to give us a chance to practice real empathy. So as much as we could to establish rapport, to hear some stories if possible. And by doing that, even just taking a few minutes to build rapport can boost our oxytocin levels in our body and that of our clients, wherein then that's the love hormone, that's the morality hormone that sets us up for better success. So just even taking a little bit of time, either before the appointment or during, to build some connection was really important for our mental health. Okay. Signing up those sympathy cards, getting them out, maybe doing a little bit more in there versus just signing your name. I've heard a lot of services that got way more detailed, right, about where they connected with the pet if the family couldn't be there, how everything went, so that they could share a bit of that story. Then here was a great idea, is that after COVID, maybe bring all of your clients in for an honoring ceremony of sorts, right? So maybe your hospital is set up for this, where you can have some sort of tribute tree, or where things can be hung on there, pictures of the pet. You can have a chalkboard with messages written on there, where you can have music and readings, and where you can really honor that bond. I thought that was fabulous. And then part of what we think is so important with protecting our mental health, when we can't care for the pet necessarily with euthanasia the way that we typically would, is to make sure that after death, we're really respecting that body. And I absolutely love Euthabag. This is a product that's provided by Jorgensen. It is designed by a veterinarian in Canada. And this takes away the trash bag, the contractor bag look that we so often use with our patients. And instead, we're using something that's going to improve our kind of moral standing, our ethical standing, where to say, I want to care for a pet's body the way that I would want my own pet's body cared for, right? That I can look at it with pride. So this was not only important for that purpose, but to limit contact with a body that might have a lot of snot and tears and everything else that comes from our sad clients on the pet's body, that we could reduce down that contamination very quickly, get the pet contained in a safe bag like this, and then off for cremation. So really love these Euthabags. All right, here's another picture of Beauty. In case those of you who love the sunflower, this just immediately brightens my day. In fact, oxytocin is built in our body through sunshine as well. So those of you who have been providing euthanasia outside in the sun, that's been giving some benefit through oxytocin production. What a beautiful picture. All right, so as we wrap up with our COVID talk here, just the importance of preserving the human-animal bond throughout. So if they weren't able to be there during euthanasia, to try to invite those goodbyes beforehand. A lot of hospitals actually provided pre-euthanasia sedation or anesthesia when the client was still there. And then remove the pet into the hospital for euthanasia, or the family stepped out at that point just to reduce contact time. But that pre-euthanasia sedation or anesthesia, so important. Encourage that personal protection equipment so that the clients could still be there, kind of allow that involvement. And then maybe a virtual presence if that had to happen, where we could have Zoom, where we could have Skype, whatever it was, right? That is what those of us who really are bond centered in our work, we need that because we know that's what we would want. And then I'm curious what else you've offered. So if you want to put anything in the chat about what you have done to be creative during COVID, to help keep your, to keep your heart and soul strong and to keep you resilient in this work and sustainable, I'd love to hear. Go ahead and pop that in the chat. This is a blog that Kata put together. We have many blogs. We put them out every 2 weeks. This was one that we put out for home euthanasia and COVID. So in case any of you are doing home services, this could be a really good resource for you. Love it. Thank you, Sarah. You did FaceTime. That's great. All right. So let's go ahead and shift gears here real quick. I'd like to know, if you were to say, what are some of the features of a euthanasia appointment that make you personally feel better about that work? I'd like you to share that in the chat box. Think about, all right, I'm about to go into a euthanasia and I want to come out with my heart light, feeling good about my work, knowing that I cared for the pet in the right way, my pet patient, cared for the client. What are some of those features that mean the most to you? Okay, just think about that, reflect on it. Because there's many that come to my mind, many things that I've honed over the years. There were some that I automatically had as a part of my euthanasia work that I've kept from the very beginning. And I've been doing euthanasia and end of life specific work now for 15 years. Yeah, 15 years. I left traditional practice after 2 years and just devoted all time to end of life. Yeah, just think about what are some of those features that absolutely make or break euthanasia for you. Okay? By all means, feel free to share them in the chat. But I'm going to go ahead and list some of mine. Number one, slowing down, taking a lot of deep breaths. We're going to find out coming up that that actually can help to reset from sympathetic, ramped up tone to parasympathetic, that state of relaxation, which helps to hold off secondary traumatic stress and compassion fatigue. So just slowing down, hearing stories. I could listen to people tell stories about their pets all day long. Some of you are like, no way, too much. But those of us who love stories and hearing about the bond, that's how we like to fill our time. So we can't do that if we're rush, rush, rush. Balanced emotions. So not only our emotions, where we're practicing with emotional intelligence, knowing how we're feeling before we even walk in the room, how we're feeling during and after when we step out, but certainly balanced emotions of our clients, right? So that they're not all over the spectrum with happy, sad, angry, guilty, all over the place, right? That we've got some balanced emotions, and we can actually help to control those emotions through good establishment of rapport. Nature around us, those biophilic elements. So as much as we can bring in plants to the room, maybe water fountains, images of the earth and nature, that is very important. And that's actually part of fear-free too. I'm going to jump up to the next column and then end with working off principles. So clear need for euthanasia. We know that this pet is suffering. Everybody is on the same page that euthanasia is the best choice and that there's no question about moving forward, right? That decreases our moral stress. Physical connections, being able to touch people, even just laying a hand on a shoulder has been missing right now during COVID. So we just recognize, I wish that I could, put my hand on their shoulder. I can't, but I'm going to find fulfillment in other ways. Okay. But hey, the more people you can hug when you get home, boost that oxytocin, good stuff. When we can deliver a technically strong euthanasia, right? Where we're not worried about, hey, did we just cause unnecessary pain and anxiety for our patient? Did we cause unnecessary worry with our clients watching that happen? So anytime we can perform a technically strong euthanasia, that's an improvement. That's where CADA can really support you. Okay. Then team support, everybody again on the same page, but hey, just your team recognizing that that was a hard euthanasia for you and maybe taking care of you, pampering you in some way. Lots of different ways to offer team support. And then of course, working off principles and not the outcomes. What I mean by that is that no matter how the euthanasia transpired, no matter the reasons behind it, you did good medicine, you led with compassion, you led with what you know to be right with your morals and your ethics, and then whatever the outcomes are, the outcomes are. Working off your principles, principle-based life. All right, we got some comments in here, making sure it's a soft goodbye. Owner doesn't feel rushed, loving the volume and tone of life, or lowering the volume, lowering the volume and tone of my life. I'm not sure what that means, but if you want to kind of add some clarity to that, that would be great. Giving the pet propofol first, absolutely. That's that sedation or anesthesia. I'm starting to refer to those pets as sleeping beauties, right? They're all relaxed. There's no pain, no struggle. And then the owner has time afterwards. Good. Privacy before and after death is wonderful. All right. So in case nature doesn't do it for you, how about some cuteness? If we could snuggle with that a little bit every day, I think we'd be happy. It's just too cute. Voice. Oh, thank you. Lowering your voice, tone of your voice, keeping things nice and low and soft. Perfect. All right. So let's talk about euharmony for the last part of our time. Euharmony is the idea, again, that when you have a euthanasia scheduled, that you can actually look forward to it and capture all of the beauty of it and the gentleness of that appointment to improve your day, okay? So I like to think about actually, I'm going to jump back. I like to picture a really busy hospital. I'm going to show you an image of that here in just a second, but a really busy hospital that there's so much going on, but yet in the comfort room, there's nothing but quiet and softness and slowness that can help to reset you so that you're not as ramped up throughout the day. If we know one thing about vet med right now, it's too busy. There's too many activities throughout the day. Our mind is going in so many different directions. I remember in private practice, I got to the point where I actually had to think about reaching for a doorknob to turn it because I was so amped up. It wasn't just muscle memory. I was like, wow, there's just so many moving parts and complexities to my day. I was overwhelmed, right? Absolutely overwhelmed. So I actually found myself gravitating towards euthanasias for the beauty that they provide. Again, that's assuming that we're doing everything right with them and that they're not causing more stress than they should. That's what CADA can help you with. So I'd like to just help us to understand a bit of an exercise here to reduce from sympathetic down to parasympathetic tone. And that is going to help us to reduce what's known as secondary traumatic stress, which is a component of compassion fatigue. If we are watching sadness, depression, trauma, intense grief and loss in front of us with our clients and our patients, that can build secondary traumatic stress if we are too amped up, if we're too pumped up. So we have to relax our bodies when we're in this situation. So number one, recognize that you're in a stressful situation. Number two, take a really deep breath and exhale slowly. And as you do number three. You relax your body, you relax your core muscles all the way down through your pelvis. Then you bring your focus back up to your eyes and you soften your vision. So when you have a threat in front of you, a perceived threat, you tend to lock in. You want to soften your vision, expand it out to the periphery. And that is called a 4-step self-regulation technique. And you want to do this regularly throughout the day. So whether or not it's a euthanasia, you're prepping for surgery, you've got that third lymphoma case coming in for the day, whatever it is, you want to practice it because it's something that isn't going to just come naturally for most of us. So that is called the self-regulation relaxation exercise. All right. So this is why we need it, right? Again, all those moving parts. And we want to say to ourselves, hey, there's a euthanasia coming in. How can and I don't want to say we want to take advantage or, like advocate for euthanasia just because you need a relaxation in your day. Obviously, we're only doing this when euthanasia is warranted, but now we're going to leverage that calm space to relax us. Okay. And while we're in that room, we are completely focused in on it. We have forgotten about what's outside of the room. We're not thinking about what's going to happen tomorrow and the rest of the day. We're trying to be mindful in the moment. Okay? Nothing else matters but these three beings right here in front of us. Okay? And do little things in the room. This is one of my favorite tips, is to put a board in the room that has the patient's name on it. Right? That is a mindfulness exercise for my team to say, wow, Gracie's coming in. nothing else matters but Gracie right now. I'm going to be fully present for her and for her family. And take a deep breath as you're writing that sign. And then this is something that I also do. I've got a picture that is outside of my comfort rooms where I can stop and pause. Again, relax myself, say, I'm not going to worry about everything that's out there. I'm just going to focus in on the human animal bond that's coming up in this room, right? Because this is going to be very scary for them, very sad and emotional. I need to get down to that calm state. So having a picture of the human animal bond outside of the room where you can just pause for a moment of reflection is fabulous. Then with regards to eHarmony, and yes, Stephanie, my Academy director, this is you on the right. It's just such a fabulous picture. But with regards to eHarmony, it's important that you know who you are, okay? What makes you tick? What are your core strengths? Because that is going to help you not only in your personal life, but in your professional life, so that you can find yourself in the type of work that really speaks to you. If you love doing euthanasia work, ask yourself, why is that? You know, what is it about me that gravitates me towards this type of work? If you don't like it, and if it really causes you stress and you it just doesn't speak to you, it's important that you know why. And it's also important that in this time for eHarmony that you focus in on emotional intelligence, right? What is your EIQ? I think they call it. your EQ, maybe your emotional kind of quotient. But what is that intelligence of you, and what do you need to work on to be ready to support these clients and to protect yourself? Again, keep yourself sustainable. So what makes you tick is so important. And at the end of the day, I'm hoping that this is you, whether or not you're male or female, doesn't matter. But when you are there with the client, and it might be 5 euthanasias in one day, that you are fully present with them. You are not absorbing their sadness. You are not absorbing their trauma. You are just simply present and a guide throughout, doing the work that you need to do. And that is what they see. But behind the scenes, you are resilient. You are certainly living with purpose, and you are staying true to who you are, staying true to yourself, so that you can continue to do this work for many years to come. I just love that picture. All right, so in the idea of Zen and a little bit of humor, because I know this can be a darker topic, I just want to show you one of my favorite videos. It's just absolutely darling, and then we'll go to some Q&A. That just cracks me up every time. I have to show it again because it's just so cute. You gotta love a cat in a bag, right? Hey, and I absolutely adore humor. So, you know, if you come to a CADA training, we do try to keep it very light. We listen to music in between, and we always have our moment of Zens after our modules, and we really gather in fellowship and have a great time. So this is one of the locations where you can come to join the CADA community. You do not need to take the CADA program to join this. We have over 1,000 members from all over the world. And we just brainstorm. We just talk about, hey, this technique, this happened, or pentobarbital is going a little bit on back order right now. What do we do? This is our go-to place to talk about what's happening out there in the world of euthanasia. We'd love to have you join in. It's open for all members of the veterinary team. All right, so let's go ahead and open it up to any Q&A that you, or any questions or comments that you might want to share there in the chat. And while we do, I just want to say again, a big thank you to Jorgensen for inviting CADA in today to speak. And I know that Jorgensen is really focused in on a lot of end-of-life products. These two in particular, I think, are fabulous. So Clay Paws is the original Clay Paw kit. It is developed out of Fort Collins, originally with Colorado State University. And if you're looking for a high quality, what I call archival clay, that's Clay Paws. It really stands the test of time. And Jorgensen is now a distributor of Clay Paws. And then of course, Euthanasia, which is really necessary in today's society to go well beyond these trash bags, these contractor bags, that really does nothing for our morale to put pets in bags like that and have them stacked up. So the Euthanasia bag is much, much better. But Jorgensen also has urns And they've got a lot of the products and materials that I use for my euthanasia, including including catheters, to my tourniquets, to their rigid 4-foot stretcher, which is fabulous. So Jorgensen, I'm really pleased for them, more than any other distributor that I have seen that has been focusing in on some end-of-life products. All right, so any questions out there on anything that I've gone over and anything that you want to share that I can do to help heal your heart today? That's what I'm here for. And certainly, Lori or any of the other panelists, you're ready or welcome to voice in as well.
You've got so much to share, Dr. Cooney, and there's so many aspects of this, and I know it's very hard to touch all aspects in 30 minutes. But we really do appreciate everything that you have done. And there is so much that she can help you all out there. So please look her up on the website. She does have CEs that she can come and do for the clinics and help people through and changing the way that we do some of these euthanasias and helping you with your hearts and being able to deal with it and not feeling like Dr. Death some days, but actually feeling like we're doing a good thing. And you are. There's a lot of reasons that we that needs to go through, and I've gone through my share and the way you're treated and the products that are used. She did talk a little bit about the paws, which are nice to be able to send home with the owner so that they leave and they have something to touch and feel as they go home and not leaving feeling totally empty. So little tricks like that that Dr. Cooney has shared in the past. There's so much more that she has to offer. So I do encourage everybody to take advantage of her wealth of knowledge on that.
Thank you, Lori. Thank you. Yeah, and part of that eHarmony idea is that we shift from feeling like an executioner to an angel maker, right? That is how our clients view us, helping them in such a dark time. That yeah, we can learn as much as we possibly can about euthanasia to pull those tips and tricks and everything in for our daily work. The CADA program right now has over 20 hours of content. My guess is within the next 10 years, we will have well over 150 to 200 hours of content because there's so much to learn, But we start with what we've got, and we'd love to have all of you get involved with the CADA program in the coming days. Yeah.
Wonderful.
Thanks, Lori. Thanks, Jorgensen.
Thank you so much. Have a wonderful weekend.
Hey, you too,
everyone.
Happy Mother's Day.
Bye-bye.